be discussing about psychiatry. What are the 4-5 symptoms which are very dangerous? They can't find it out.
Suddenly the person started acting indifferently. He was a cool person before. Suddenly he started acting aggressive or started acting faster. Directly, sometimes how patients tell is, they don't tell I want to die. They'll tell I think it's better if I don't be dead tomorrow in the morning.
If a common man wants to know that whatever he's doing or whatever he's thinking is not in the right way, how he has to approach, how he has to find himself.
Panic, anxiety, OCD, substance, child, adolescence, geriatric range. Males and females both are going through things. It's not just one person. The men are not able to cope with it.
They think physical health is much important than mental health. Mental health issues also in the form of physical disorder.
Negative side is also there where people are putting up, it's like branded, I have OCD, I have depression. They're not enjoying life the way they want to.
Okay.
Not satisfied.
Okay.
Feeling low.
This is a nice definition.
Actually the word has been overused, depression, anxiety. Simply if you feel low, we start talking that he is depressed.
I think more than the patients, doctors need help.
And why people are not talking about this sexual problems very often?
Wide range of sexual problems actually. There's people are so disconnected with each other. We are waking up to the screens. We go back to sleep with the last thing we see is screen.
So what is panic attack?
Your neurological system will be taking over your body, and you will literally you feel like that I am losing my control, and I am being controlled by someone else. On that basis only, what we have did is, all the facilities are there in single website, and this is unique, and this is the only website which is having all different verticals of mental health in single platform.
Hi, I'm Dr.Mask and welcome to Dr.Mask podcast. మనం ఈరోజు విల్ బి డిస్కసింగ్ అబౌట్ సైకాట్రీ అండ్ మన మెంటల్ హెల్త్ ప్రాబ్లమ్స్ గురించి, ఆ తర్వాత స్ట్రెస్ గురించి, సెక్షువల్ ప్రాబ్లమ్స్ గురించి, ఆ తర్వాత ఓసిడి, ఆ తర్వాత హౌ ఆర్టిఫిషియల్ ఇంటెలిజెన్స్ ఇస్ వర్కింగ్ ఇన్ సైకాట్రిక్ ఫీల్డ్. ఇవన్నీ కూడా మనము వి విల్ డిస్కస్ విత్ ఎక్స్పర్టీస్. ఇక్కడ మన దగ్గర డాక్టర్ పవన్ ఖండే అండ్ డాక్టర్ నిధి, senior consultant psychiatrist in Amodhealth. We will welcome them. Hi Khande. Hi Dr. Nidhi. Hello Naru. Yes. Let's go into the topics.
Yes.
So let's start with the main basic question. What kind of patients you will actually normally see in daily life? Me hospital OPD setup lo, what kind of patients you see daily as a psychiatric doctor?
Actually, we see various kinds of patients, ranging from depression, panic, anxiety, OCD, substance. It depends. Some of the seasons there's more substance, there's more depression. So seasonal variations are also same. And child, adolescents, those cases also we get. And geriatric range, all kinds of cases. And also there's layers in psychiatry where we are coordinating with other departments and we are dealing with them. Like we are called upon when they find difficulty in, suppose they have a surgery to take over, and there's a patient who's being difficult, who's having anxiety about the surgery, so they call us. So then we deal like that. So there is a consultant lies in psychiatry.
Okay. Now psychiatric people are going for even cross department.
Yes.
Okay. Nice. Yes. Okay. First మనము ఆ తర్వాత మనం నెక్స్ట్ మాట్లాడుకోవాల్సింది ఏంటంటే, ఇప్పుడు మనకు మెంటల్ హెల్త్ గురించి మాట్లాడుకుంటే, what are the things which normally this generation men are going through psychological గా?
Not only I think just about this generation, in general how man was treated since last, అంటే మనం చిన్నప్పటి నుంచి కూడా ఎక్కువ ఏదైనా చేయాలంటే అమ్మాయిలాగా చేస్తావు, ఏడ్చితే అమ్మాయిలాగా ఏడుస్తున్నావా, ఏదైనా చేయకపోతే ఇలాగా చేయాలి అని ఎవ్రీ టైమ్ వీఆర్ హ్యావింగ్ ఎక్స్పెక్టేషన్స్ మోర్ దాన్. ఎట్లంటే మనం వర్క్ చేసేదానికి ఇట్స్ ఆల్వేస్ కంపేర్డ్ విత్ సమ్వన్ ఎల్స్, జనరలీ మెయిల్స్. సో ఇప్పుడు ఎలా ఉంటుందంటే, ఇఫ్ యూ గో అండ్ కన్ఫ్రంట్ సమ్ ఐ హ్యావ్ దిస్ ఇష్యూ విత్ దెమ్, it's men generally feel it as a defeat. So they generally don't come open up with their problems. So they have a lot of problems running inside them. Still they will be keep on working, still they will be keep on being happy, they will be trying to entertain others. So just they will not admit it that fast until it's too late. So that's why generally when we see like suicide attempts ratio to complete suicides, many number of attempts are there more from the females, but number of complete suicides are more in males.
Okay.
Because until the last stage they don't open up.
Okay.
So I think now it's the generation as it is moving forward. I think the boys and the men are opening up for the mental health, and they are admitting it that we are having this issue. I think it's a good thing that even the men is also coming up and admitting their problems, that we are having some mental issues and all.
Okay. So ఇప్పుడు suicides, like what are complete suicides and what are partial suicides? Why women are more into the committing suicide category? Why men are like delaying this treatment or seeking help from professionals? Why it is like that? Because of stigma that mental health is somewhat people like the society will see them in a wrong way, or else judge them. Is that a reason, or else there are some other reasons, family reasons, or else like is there any other reasons which we can find early? And మన ఫ్యామిలీ ఫ్రెండ్స్లో ఎవరైనా ఉన్నా కూడా అలా మనం అర్లీగా సైన్స్ మనం గుర్తుపట్టాలంటే ఎలా?
So actually, males and females both are going through things. It's not just one person, one gender related, but the difference is that the men are not able to cope with it. Because they are being conditioned to not express their emotions. So they're binding by the societal norms, where they are just keeping themselves and acting tough, because that is what is expected of them. That is what comes natural to them. And so they continue to be like that. So they're piling up that emotions inside, and they're not bringing it out. So they're not confiding, they're not having a let out. So it's all keeping the pressure inside. Is at the one point when they're not able to take it out, then they end up in the suicide. And suicide by death is like completed suicide. You're not surviving the suicide. So that's what is.
Okay.
But women, what happens is, although even they silently suffer a lot, but the thing is, they somehow cope better because they are expressive. Although they talk about their pain, they're almost all the time talking around it. Which is again losing the point, but still they are able to express better, able to confide in at least one person or two people, their friends, close relatives, or whoever they are able to say. And it's not frowned upon. Like it's accepted that a woman is sharing, talking about her feelings, so they don't feel that much judgment. So that stigma is little less towards women. When a woman is crying, although she's called sensitive, but still it's accepted. But when a man cries, it's seen as like some big against the society, and they call him names like already Dr. Pavan mentioned. So that's why the stigma is causing this thing.
Okay. How to break the stigma?
I think it's already breaking. Actually, in my clinic also, I've seen more men come. They're opening up, they're coming, they're asking for help. That itself shows that it's breaking the ancestral norms. So they're coming out of it, they're talking, they're mingling, they're asking for help. So that is a good positive shift.
Okay.
I think when we are talking about the stigma, it's not only just within the males. Even it's in the society itself. When you talk about mental health, when you're talking about someone having some psychotic issues, I think people are getting more away from the topic itself, because they think this is something different. It's same like physical health. If I have a tummy ache, it's something like my brain is also having some issue. That's why it's getting anxious. So people are not able to differentiate. They think physical health is much important than mental health. So what the thing is, once they realize it is equally important, I think they can do much better. And sometimes we see mental health issues also in the form of physical disorder, like somatic syndrome. We have something called as somatization of symptoms, and we have somatic disorders where patients transfer their pain into mental pain into physical pain.
Physicality.
Yeah. So that is where, until they get it too complicated, they are not coming up and ready to take the help. So it's not just within the gender. I think it's both in the society itself. They have still stigma that I think we might be seen some way differently. Actually, even in the pictures, even in the movies, wherever the mental health facilities are shown, when they show something about psychiatry, they always show about something which is not at all being practiced right now. Being chained, being using ECTs, non-modified ECTs without giving any anesthesia or without giving any muscle relaxants, which are being followed previously. I think it's around 1950s or 1960s. They used to use such kind of methods to do it. But right now we have a vast group of medications and different classes of medications where we are able to achieve and see the much better results without using such kind of techniques. But the only thing is, because of these things which are being shown in the movies and in the series or whatever it's being published in the social media or mainstream media, because of that, people are still moving away to take the help from a mental health professional. I think it will be much better if they show it in what are the recent advances and what is really happening. So people will come forward and be ready to take the help.
Yes. That's good. Okay, sorry. Next question is I'm a person, okay, I don't have any idea about psychiatry. I don't have any, information about this psychiatric disorders. So if I wanted, if I podcast manal chustane nenu chusanu anko, if I wanted to know that I have some issues, if a common man wants to know that, whatever he is doing is not correct, whatever he's doing or whatever he's thinking is not in the right way, how he has to approach, how he has to find himself that, he is suffering from psychiatric disorder, and how he has to, break that stigma in the family, and how he will approach hospital or, doctor. Like, how can we help these kind of people to come approach us professionals?
Firstly, awareness building. So now I think there's better awareness compared to previously. Now there's social media, everybody's talking about their mental health. It's become like a trend actually. So that's why the men are also coming forward. That's what I think it is. That everybody is more open to talking about the mental health. Okay. Although some negative side is also there, where people are putting up, it's like branded, I have OCD, I have depression. So it's branded, they're already self-diagnosing themselves based on all these reels, 30-60 minutes reels, and then they are like coming to psychiatrists and they're saying, I have OCD, treat me. So they're not ready for proper assessment. So they already fix themselves to that, they identify themselves with that illness, and then they come to us. There's no curiosity of what is wrong with me, what is happening to me, why don't you tell me what is happening. Those kinds of things are not there. So that is the dark side, but there's also positive side, that social media has, the benefit of social media is that it's visible to everybody. Anybody has an access. So that is creating awareness. So awareness in the right direction would be better, where professionals are actually creating the awareness rather than people who are not qualified. So it does not go into the wrong direction and people don't make up their mind that they have some illness which they don't have. Yeah. Then go to living their life with that label that they kept it to themselves actually. So that would be the first step. And next is that when they approach us, they can, now there's so many other medias, like you can do online consultation, you can come visit, anything. So they can come approach us. There's always confidentiality maintained, so they don't have to worry about the stigma unless there is some way that if we think that they're going to harm themselves, only then we bring in the family or some close member, so that they are not taking that step, that extreme step is not taken. So to prevent their own self-harm, only we do that. Okay. So that is, and also we try to explain the family members too, so that we can reduce the burden of the family as well as reduce the stigma. So the overall holistic treatment is given, not just seeing only the patient. So their environment is also taken into consideration.
Okay. What are the 4-5 symptoms which are very dangerous for society, for the well-being of family, and which they can't find it out? Like, what are these things which normal family people also can find out in their family setups or their family members? What are the 5 symptoms which we can find out in people?
Sudden change in behavior.
Okay.
Suddenly the person started acting indifferently. He was a cool person before. Suddenly he started acting aggressive or started acting faster, and being aggressive verbally or physically, which was his not type before, or the frequency has increased from before, or thoughts when he's talking about suicide, when he's talking around that directly. Sometimes how patients tell is, they don't tell I want to die. They'll tell, I think it's better if I don't be dead tomorrow in the morning. I think they'll talk like, what will you do while talking to your friend? They'll be like, Mama, if I don't come to you and meet you tomorrow, how will you feel it? So they'll be talking around the topic, but not directly. They'll not be talking directly. So sometimes how it is. So we have to be little aware and know the person more, so that we can identify the cues faster. What are his cues? What is ever he's talking? And sometimes how people are little aggressive behavior, like they'll start hitting themselves when even the anger outbursts are increased. So they'll not be able to control the anger. And work performance, especially when it comes to work. So before, if I am able to do work in 5 minutes, now it is taking for me to finish the work 15 minutes, half an hour or more time, because I'm not able to put more attention, not able to concentrate on the work which I'm doing. So that all, in that perspective, we can see few cues where and how is his overall mood. So in that way, if you can look to a person, then we can identify that he might be going through something.
Okay.
So there is nothing pathognomic like that. If you have this symptom, you will be having this.
Okay.
So there's nothing pathognomic in psychiatry. So it's not just a simple thing that if this is having, this is the thing.
Okay.
But there is some issue we can identify, and it's always better to ask a person whether he's doing well or no.
Okay. Nice. Okay. My next question is about sexual problems. Okay. How about this topic? Like, why this topic is very stigmatized, and why people are not talking about this sexual problems very often. Even the influencers, even the professionals also are like, not coming forward and, talking about the sexual problems very frequently or very seriously, because it has some, social media has its own restrictions. So we can't talk openly about sexual problems. So that would be one reason. But why this stigma is not going, and what are the sexual problems we and you in your daily setup, in OPD setup, what are the sexual problems people come with?
Wide range of sexual problems actually. There's erectile dysfunction. They're not able to get an erection. They're not able to maintain the erection, or there's premature ejaculation. So there's performance anxiety, which is very common, especially in men. So they are not able to open up about their needs. Both genders are not able to openly talk about it, because in our society it's frowned upon. It's shied upon, that this topic is not something we talk openly. If somebody is talking about it, it's more acceptable from a male point of view rather than a female point of view. So the partners are not able to communicate with each other what they need. If they're not communicating with each other, there's a gap, and that creates the tension that gives anxiety. And anxiety with sex is like a bi-directional thing. So if you have anxiety, you will have sexual problems, and if you have sexual problems, you will get anxiety. It's the same with depression also. So there's interlink between various things. So one leads to other, and the other leads to this. So like that. So the various things are involved. But the thing that stigma is causing, because societal things again, we are taught to relate our men are taught to relate their manlyhood with sex, and women are not allowed to speak, because if she speaks, she's considered like a very shameless woman. So she's not able to open up and ask what she wants, and when she's not able to ask, that creates a pent-up frustration in her, and that again affects the spouse, because she's not comfortable in that sexual relationship. Then she's not satisfied. The same thing will affect the husband or the spouse or the partner, and it creates the friction, and there's gap. So neither of them will reach the full satisfaction because they're not opening up.
Okay. My question will be why this sexual disorders, sexual problems like premature ejaculation and performance anxiety, these things are physical or psychological?
It can be both. So young people, most likely it's psychological. What happens nowadays is we are all busy in this digital age. We are like meeting deadlines. We are having constant pressure of meeting at work, and so the only time we get some kind of lesion is coming back home. But people are so disconnected with each other. We are waking up to the screens. We go back to sleep with the last thing we see is screen. So that again is affecting the sleep cycle. There's constant stress for various aspects, financial and otherwise. So that stress is causing stress hormones, cortisol to increase. That again affects their physical health. So it starts at mental or physical, but it's again affecting the other. It's like a bidirectional, like I said. So this is causing the disconnect. They're not finding, and also one more thing is there's widespread social media, porn availability. So they are more exposed to that high yield, visually intense things. So when it comes to real intimacy, that takes slower time. That's like more time consuming. So they're not able to give that much patience and connection for it to build. So they want quick. So that is instant. So they're not able to do that. This connection is not made. So when the connection is not made, again communication connection is not there, then it's not going to happen.
Okay. So we can say that the stress caused by external environment because of the family, or else because of the job, or because of society, because of the people around us. Even that stress can cause performance like anxiety, like we'll be stunted in the performance. So we get
Also,
performance
there's,
anxiety.
Body image like comparisons. So you're growing up seeing things on TV, on social media, where you're comparing yourself. There's all that negative impact is there. Like you're growing up thinking you're not perfect, your body is not perfect. So when you're constantly monitoring yourself, you can't enjoy sex. So that doesn't go along. You're constantly thinking you're not good enough, your self-esteem is low. So your mind is always running. When your mind is running, you can't relax, and you need a relaxed mind for sexual activity. So that's why it's not happening.
How about a partner helping out performance anxiety man? Like how to do it, or else what would be the partner's work to help this man who is having this performance anxiety? How can they help them on bed, or else in generally
You're saying
in life?
a man has the sexual problem?
Yes, like if a man has performance anxiety, how a partner, like his woman, how she has to deal with it? How she has to make sure that this guy loses his performance anxiety, and
You mean like how will she be helpful in making him better?
How she can be helpful.
Yes.
So basically, first of all, it's a normal thing.
Okay.
Because your Indian society, there's arranged marriage, and you're getting into that marriage without getting to know much about the person. So that anxiety will be higher because you don't know that person much. So that is understandable. So that is the first thing that the man, if the woman is mature enough to realize that, she can convey that. There's basically communication is the key factor. Able to talk openly, become more comfortable in talking and asking each other's needs, and then getting to know what helps the other person relax. So various people have various ways to cope with things. So healthy coping is better rather than finding some other way to do it. So you can talk about it, and then slowly that anxiety, and start with non-sexual touch. Instead of directly jumping into the final act, go with non-sexual way. Find out what excites the other person. So slowly build that relationship. Sexual compatibility is built. It's not come overnight. It takes time. So that patience and time should be given. So that's what the partner should understand. Whichever partner is suffering, give that person time. Communicate with the person, give your patience. Don't directly bombard ki you're not satisfying me, you are not able to do. That creates again a negative impact. More anxiety is created. So that creates a negative environment. So their relationship won't build if you create that negative environment.
Okay, we heard about men sexual problems like erectile dysfunction and premature ejaculation and performance anxiety. What about females? What kind of sexual problems they will have?
Pain during sex. And also they are not able to open up. Basically their needs are not met. So they are not able to ask for what they want. And when they ask, they are being told that they are very hypersexual. They are asking too much. This is not our women should be. Women should be asking. So that creates again other things like depression, anxiety. So she's not able to enjoy that. So mostly this is the common things. She's not able to have an orgasm. So lack of that. So that is also, these are the common things that women usually complain about.
Okay. These are the sexual problems, or else these are the dissatisfaction because of not having good sexual practices.
I think again they're interlinked.
Okay.
Because if you have sexual practices, good healthy practices, then you would deal with these problems better.
Okay.
Even if you have these problems like not having an orgasm, once in a while not having an orgasm is a normal thing. So when you deal with it better, when you tell out and you communicate with your partner, so then it's dealt better, then you won't get a repeated cycle of frustration and anxiety related to that. So it breaks that cycle.
Okay.
That's right.
Nice. Great to know. Coming to the next topic, we'll talk about depression. So what is depression in a layman terms? In a very layman terms, because I know that you might be knowing the definition very nicely, but I wanted our viewers, whoever are there, they are not doctors, so they wanted to know what is depression for a normal person who are seeing this. They have to understand.
And not enjoying life the way they want to.
Okay.
Not satisfied.
Okay.
Feeling low.
This is a nice definition for for the normal people that they can understand.
No,
I mean,
correct.
it's wide range of things.
Yeah.
Okay.
There are people who function very well. They go to work and still they're depressed.
Okay.
So externally they're putting up the work. There's functionality, but that does not mean that they're well.
Okay.
They're not feeling the satisfaction on the inside. They're not happy on the inside.
Okay.
So it does not just because you're waking up in the morning does not mean you're looking forward to waking up.
Okay. Yes.
So that is one of the things that I think.
Okay.
Yeah.
One of the spectrum of the end.
Okay.
Depression can't be told in single word or single sentence. It's
Okay.
not like that. For suppose, if some of our known friend has passed away, obviously we'll be feeling depressed. We'll be feeling low. Yes. We'll have low mood, or we'll be dull. We won't feel like doing any work. We don't feel like meeting anyone. So that doesn't mean that we are depressed at that moment. That's a normal human expression. How we tend that something when something bad has happened, or when something when
you lose.
like when you lose someone who are very close to you. I think that is very common way of reaction how people do. That's a humanly thing. But when it is not being able to control even after the normal within the normal limits, if it is extending it more, and if it is you're not able to perform your regular activities, not being able to do the needs of the social culturally. For suppose me being first son of my parents, I am expected to do some jobs. For suppose taking care of my parents. I need to attend few functions or few programs instead of my
family, instead of
families and all. So like if I'm not able to do that, if I'm not able to take care of my family, if I'm not able to attend family functions, or if I'm not able to attend my office regularly, then the problem arises out, and then people start talking. That's then when you have to come for help. Mm-hmm. It's not that the word has been overused, depression, anxiety. Simply if you feel low, they start talking that he is depressed.
Okay. So yes, true, very true.
The words, that's a big terminology, and that's a big thing to tag on him. That depression is not a small thing just to tell, he's depressed, she's depressed.
I think if it's subjective. Like you can't box it in a definition. Even textbook definitions sometimes don't work. Mm-hmm. So it's if the person is feeling that he's not happy, they have been trying, they have been coping, it's not happening, then they can come for help. There's no, you don't have to question yourself, okay, I don't fit into the definition. Okay. You can just come. It's okay if you don't think that you fall into that category. If you think you want help, you're not able to do on your own, then fine. You can come. What labels don't matter at the end of the day.
Okay.
And the one who is coming for help, they should gather a lot of courage to come and ask for help. Because normally people doesn't come for help. They'll be like, why you have to go to meet a psychiatrist? It's normal. Because generally they have one stigma, or one misconcept that if you start taking medication of psychiatry, you will become more mad. These are the
Is
things,
it true?
Yeah, these are the things what generally people talk outside. So generally, what we get many times, patients come, they'll start taking medication for 3 to 4 months. They'll take regularly. They'll feel much better, and next time they'll come for the routine follow. Then someone in the family or someone in a relation or someone who is the known people of them, or some medical shop vendor like pharmacist, they'll be like, hey, you should not use medication for so long. If you use medication for so long, you will go crazy. See, if the person who has taken the medication for 3 to 4 months, he has seen the better things, like what he has gone through and what all changed within the 3 to 4 months after we started medication or whatever we started therapy. Or so, because the people, most of them have the misconcept that if you take medication, some side effect will be there. I'm not saying there is no side effect with the medication. Every medication has a side effect. Every medication has a side effect, not only psychiatric medication. In that point, if you have to talk in that point of view.
Yes.
But the thing is, like all the professionals, mental health professionals, they have gone through a lot of practicing. They have a lot of experience. They have studied a lot. They have practiced a lot. So I think anytime it's better thing to go to a professional and seek help and ask their suggestion, either to start a medication, to stop a medication, or to continue about the medication. What all you have doubts, it's better to go to a professional than going listening to a person who is not much doesn't have much knowledge about that.
On.
Yes.
It is always better to take
Help from the professional, because the patient, we are all here to help the patient.
Yeah.
We are not against him so that he has to use medication more, so that we will get something out of it. It's not about getting something out of it. It's at the end of the day, if a patient comes and says, sir, I am feeling much better and I think my life has changed after you gave medication, that feels more happiness for us than getting the OP fees or like getting the money out of it. Yeah, that is the most valuable thing what we get from the patient.
డాక్టర్స్ అంటేనే మనీ తీసుకుంటారనే దీనికి వచ్చేసారు జనాలు. బట్ యా, ఇట్స్ ఓకే. వీ హ్యావ్ అవర్ ఓన్ గుడ్ థాట్స్ అబౌట్ అవర్ ప్రొఫెషన్.
Not everyone is the same way, right?
Yes.
See, there might be commercial doctors, there might be non-commercial doctors. There are many doctors who are working
Service oriented కూడా ఉన్నారు.
There are people who work for service. So it's there, by seeing few examples, you can't label everyone the same way, right?
Yes. Okay. Next, we'll go talk about panic attacks. So, what is panic attack and how people can feel it when they are alone? Like when they are having a stress-related panic attack. How these people feel and how they have to find out that that is panic attack.
So, just to tell in a simple word, a panic attack is nothing but an overactivity of nervous system.
Okay.
Triggered by a false or what do you say?
False alarm.
A false alarm.
Okay.
From emergency department because they are having that kind of high intense attack, so they think they're going to die, so that kind of impending doom they'll feel, so they come to the emergency department thinking they're having a heart attack, and then they're being treated for it. Like they'll investigate, they'll do a ECG, they'll do a 2D echo. After doing everything, then they finally come to the conclusion that this is not a heart attack. That's when they are referred to us. So then we try to find out what is being stressing them, whether they're going to a chronic stress or there's a trigger or not. And then we try to explain the patient, this is not a heart attack. This is because you panicked. It looks similar. There's palpitations, there's sweating, there's chest pain. So all that looks similar to heart attack, but you're not having a heart attack. So that is explained to them, counseled, and then we put the required medications. So it's a small thing, but panic becomes
that's what.
So it's excessive for something that is not there.
It will be subjective
but
also.
So severe that people take it that severe they come to the emergency.
Yeah. True. They think that it is a cardiac issue.
Your neurological system will be taking over your body, and you will literally you feel like that I am losing my control, and I am being controlled by someone else.
Okay.
It's like I can't move, I can't talk, I can't ask for help. I am like a freezed, and I am being trembling with sweat, lot of sweat, profuse sweating. I'll be having like palpitations, which I'll be knowing my heart rate itself, which generally we don't feel when we are sitting, when we are relaxed. So once they start getting that, then they'll be like, I think I am going to die. So once you get that thought, once you experience it, until then we can't say how severe it is and how traumatizing it is. That's why they immediately rush to an emergency department, and they feel, I think I got a heart attack.
Yeah, true.
So this keep on happening. So they keep on coming to ERs regularly. But the major thing is, they don't think at least once, just okay, I think it's better to go to a psychiatrist and meet him once.
Yes.
I think it will take at least 6 months or 1 year for him to come and meet a psychiatrist from his first episode. So that is how the stigma, and even not only in the common people, even in the doctors, I think many of them, they think psychiatry is the last referral thing which should be given.
So, మనం ఈ డిస్కషన్లో I got another question. Like, what are the common psychiatric issues we see in our community, in doctors community? మీరు ఎవరైనా డాక్టర్స్ ని ట్రీట్ చేశారా సైకాట్రిక్ ఇల్నెసెస్ ఉన్న డాక్టర్స్? Yeah, because we have high stress environment, work, jobs, so and we have our own issues with the family, society, and so many expectations. So how about the doctors? Are there any doctor
I think
patients?
more than the patients, doctors need help.
Don't say that, people will understand in the wrong way.
Because we are also human.
I'm just kidding. Yeah.
We are also human, and we tend to forget ourselves.
Yes.
So I think since I was in first year of postgraduate, I've been known so many doctors who needed help.
Okay.
They will not.
You have seen them.
Yeah,
Okay.
they do come to us. They'll say, we want to talk to you, but we don't want to come to your department. We don't want to be labeled.
Yeah,
So
true,
they just
true.
want to talk. They don't want medications because that again stigmatizes them, that a doctor needing medications, how is he going to be full function, how is he going to be there for the patients. So they don't want that stigma, they don't want their families involved, they don't want anybody else, their co-PGs, their department to know. So all
Literally,
that
they don't want anyone to know.
No, they don't want to know, but they want help.
Yeah.
They don't want medications.
Humans need help.
They just want counseling, they want to talk. Sometimes that is not enough.
Yeah, true.
They are constantly under the stress. So even when we tell them that you require, they don't take our complete help. We just want to talk, and it is temporary. When you talk and then it's not helping
It'll be
them.
somewhat relief. They will be
Yeah,
there,
it is
but
relief,
not,
but
yeah.
temporary, because they are more severe stress they're going through. So I think they do need.
Any real time and real life incident with the doctors, like where a person,
From first year I'm hearing that
Okay.
they're not able to deal with the department politics.
Okay.
They're not able to deal with their new schedules, like night
Okay.
duties and studying, their exams coming up.
Okay.
So they are, and most of them, some of them take the branch that they don't like.
Yeah, true.
Study that subject which they don't like.
Let's go to another topic. Okay. So మనకు అడిక్షన్స్ అనేది సైకాట్రీలో ఇట్స్ అ వెరీ నోన్ టాపిక్, అండ్ యూ పీపుల్ డిస్కస్ విత్ సో మెనీ సైకాట్రిక్ హెల్ప్, లైక్ అడిక్షన్ ఉన్న పేషెంట్స్ చాలా మందితో మీరు డిస్కస్ చేస్తారు, అండ్ యూ విల్ హ్యావ్ దిస్ ఎవ్రీ డే ఇన్ యువర్ లైఫ్. So what are the misunderstandings, or what are the misconceptions in this addictions?
I think one of the most misconception that we have of addiction is that they are willingly doing it. So why do we need to treat them? No matter how many times we treat them, they're still going back to the drug, and then we are going back to them again, trying to counsel. It becomes like a circle, because we are like, how many times should we treat this person? No matter how many times I tell you, you're still coming back to that. So we are tired. We're telling the family members. Family is also tired of them. So that's why it becomes this circle where nobody is able to break. That is because that is not the issue. The issue is never the drug. The drug is what is it's replacing it. That is the issue. What is the drug replacing? Is it emotional pain, or is it because they're feeling lonely, or some stress they're going through? So that drug is like a relief. So that relief is what they're getting from it, temporary although. So it's an unhealthy coping. So you want to find what it's giving them. So you should never ask how much you're taking and all that. First thing is, what are you getting out of it? Like, what are you feeling from it? What is this drug doing for you? Like, are you feeling relief? Is it a companion? What is it for you? So any kind of addiction, whether it is gambling, whether it is a drug addiction, alcohol, smoking, anything. So it's something that is getting relieved. So even I had this stigma towards them because starting when I was in a first first year PG. So then I came across this experiment that Alexander Bruce did. It was done a long time ago. So what he did was he kept rats in a cage and he provided them with water. One bottle water and the other bottle was cocaine mixed. I mean, there was morphine mixed in it. So the rats always went to that cocaine water. They were isolated in one cage. There was one rat. Then they started asking the different question: why don't we make it more interesting? So we'll replace it. They made a rat park. So that rat park, there was given companion. Rats were given companion. The previous one was only alone. Each one in one place. So this rat park, they made like 2-3 rats in the same cage, and they provided the same thing: one morphine water and one plain water. So the people, the rat that went to morphine water also, who was addicted to morphine water, they preferred the normal water. They were happy in that environment. So what we need to know about addiction is, it's never about the drug. It's what the drug is replacing. It's the environment. What the person is lacking in the environment, they're trying to find it in the drug. So that's why you need to treat that. They're going to relapse if you're only going to detox them, trying to get away from that drug, because you're not replacing the drug. You replace them with improving the environment, improving the relationships, bringing back that connection in their life. So they want purpose, they want meaning. So if they get that, then the drug is automatically, it's gone.
True. How does this addiction works? Like how it starts, how it comes into life, and how it becomes part of life, and how we can't get out of that. Like how this exact phases of life will be with the addiction, like to any addiction.
Any addiction starts first with just first taste.
Curiosity.
Yeah, curiosity. It could be somebody. Some common thing is your friends' peer pressure.
Okay.
So you do it for the trend, you do it for the pleasure. Then slowly, when you are struck with some loss or some trigger, so then you go like, okay, that is giving you solace, that is giving you relief. So you go there. So you go to that drug, you go to that alcohol. So you drink, and then slowly you're forgetting your problems for at least temporary. So they then again go drink. So it becomes like a habit. They are going, craving it, and previously they are not, whatever the amount they were drinking is not giving them satisfaction, so they go for higher amount. So that's how it becomes dependence. Their body becomes dependent on it, their mind becomes dependent on it, and they are so into it that they're not able to come out of it without a help, without somebody recognizing it, without themselves recognizing it. So
very nice. Okay, so one of my friend, he is my very close friend. That guy, he used to play gambling. Okay, so he started, as you said, he started for fun, and it has become a part of life. And after that, he lost so much of money because of gambling. His family got to know about it. They went to this behavioral therapies. He seeked professional help and all. Again, he came back to normal life. A few days he was good. He was not gambling. Again, he started after a few days. I don't know, some trigger happened, and again he started gambling. He lost money. He called me once, and he was like, Mama, I can't, break this cycle of gambling. I told him that you have to delete all the apps, and make sure that the money which is there in your account, shift it to your bank's dad's account or mom's account, so that you won't be thinking or doing anything with the impulse. So I said that. So how about the addiction to gambling works? Like people, this substance is okay, fine, because substance, the physical body will get attached to that need, to that presence in the body. How about this gambling, which is not physical, it's not a substance, it's just a mind game? Like why people couldn't resist this kind of temptations?
Psychological dependence. Okay. So even psychological dependence is a factor. Even when the body is not addicted, your mind is addicted. You are constantly thinking about it, you're craving for it, your mind is on that. So that requires more of sessions, counseling, because your body is fine. If your body is not doing that work, it's fine. But your mind is still stuck there, still in that loop. So you want to get out of the loop. You want to go for some counseling sessions. You want to see other people who have gotten out of it, so they get that encouragement. Ki, yeah, if they can get it, I can do it too. So you need to come regularly for that. They will get some motivation enhancement therapy done, and we can try for some. There are also drugs which work for such psychological dependence, but it's more about therapy because your mind is addicted there, so you want to come and enhance that and motivation. So that requires a lot of therapy sessions.
What about this rehabilitation centers? How does this works, and how people should know about them, and how people are having the stigma that if you go to a rehabilitation center, people will label you as some psychiatric patient. So what are these rehabilitation centers? How does they work, and how does they help people who are in need?
The rehab actually, it's like for people who are not able to do it at home. So what we do is we admit the patient, and then we keep them for detox time, a week or so. After the detox is done, we send them back. It's like you can go home now, you can be on the medications, come back for regular checkups. But what happens after they become outpatient, from inpatient to outpatient, they go back to the same environment which is creating this loop. So sometimes they're not able to resist that same environment, right? So they are not able to resist the craving. Even though we are putting them on medications, like I said, the drug is replacing something, we are not working on that. So again, they're going back to that thing. So when they're repeatedly going and want to help them as inpatients or outpatients, we refer them to a rehab, because rehab is like for a longer duration. They are there and their environment is controlled. There's
Rat park. Is it like a rat park? Is it like a rat park?
But the thing about it is they're not finding connection there also, because it does not involve their environment. They are just going there temporary. They are aware of that, and they are there for few months, which they are good. They are fine. They get completely out of it. Then they come back to the same environment that is creating the same
cues.
So it is helpful, but only for people who are really motivated. So after coming out of it, they should be motivated enough. Yeah, I shouldn't go back, or their family is supportive enough. But what happens with family is they come to that stage where their caregiver burden is high. So they are having some negative emotions towards their own family members. Like, you are going back there. What does it matter? They start suspecting them. Like, even if the patient is not drinking, they're like, you drank it, Gabe. I can smell it on you. So when the patient hears all these things, they'll be like, oh, even if I'm trying, they're not appreciating me. Why should I care? Why should I struggle so much? Nobody is ready to believe me. So they go back to that. If you're going to blame me for being a thief, right, might well as steal money. That's how it works. Like, they get discouraged. So the environment also matters. Family matters. If they're going to be negative about what they're doing, then they're going to go back.
So family relationships play a major role.
Yes, they do.
They do.
Yeah. Okay.
That's why we ask even the family members to come. Like, you come and get a counseling done along with you. We'll explain you how to see suppose they're going to go in relapse. There'll be some signs. So you see for those signs, and don't go too negative and speak negative. Don't express too much don't be too overprotective. Don't be too negative also. Keep a balance so that they can be open with you, not hide things from you, or not be able to tell you things at all. So family is important.
Okay, fine. We are talking about family. So my next question would be what are this family dynamics, and how this newly married couples, if they have any psychiatric issues, and how often they have to get to the counseling. And these days people are having a lot of psychological issues, and they are getting married without saying without discussing it, or without revealing it to the opposite partner. So if this kind of people, they have been genuinely in love, but they don't want to disclose that they have this psychiatric issue. So if the partner gets to know, male or female, anyone, the opposite partner, if they gets to know like how they have to come to the hospital, what are the counseling methods for family or for the married couples, like how they have to keep the sanity in the marriage, how it will affect the next generations, how this affects the next generation. So my question would be like what are the things which we face in our OPD setup, what family setups and newly married couples come with this kind of problems?
The first thing what we'll be generally experiencing is generally how our Indian culture and how things works is after marriage, female will be coming to male's house, groom's house.
Yeah.
So everything, whatever she has grown up for last 20 or 25 years, what all she has gone through, what are the conditions, what are the thoughts, ideas, and what is the conditioning in their house is different. And out of nowhere, suddenly she steps into a new house, and entire thing is different. It will take little time for her to adjust. It's something. It will take time for them because it's a new thing for them which they are going through, and it's a big thing and a big ask also. Because suddenly, out of nowhere, when you're in your parents' house, you won't be expected to do few chores.
Yeah.
But once you go to your in-laws house, or you will be. If you don't go to in-laws house, for suppose you are gone out, you are staying in some other place. Until now, you are being protected by your family. Out of nowhere, suddenly you have gone to your house and you are living with a new person who you don't know before. If it comes to love marriage, also you are being protected before and you are being a different person. But after marriage, it's a completely new thing because you have to take care of your own things because you are moved out from a protective environment to yourself. You are the one who has to handle it from here.
Yeah.
Because you have made your own family. So that is the first thing what they will be starting having. So with this anxiousness, and with this things, and the cultural shift is there. So that is the first thing what generally females face. And secondly, when we see from the perspective of male, what will happen? So now, until now, he's a single. He can do whatever he wants. No one questions him. He can go anywhere, and even parents doesn't ask much.
Yeah.
But once you get married, you are responsible for the other person also. You are the one. Sometimes, not most of the time nowadays, when females are working. So, I think dependency. It's like someone is being dependent on you, or someone is like you have to take care and you have to start a family. There are many things which the boy will be thinking in his mind. I have to start, I have to do that, I have to do this. So there is little stress there also. There's little stress this side also. And generally why these all things happen? Because what happens when the both two people, when the bride and bridegroom or the newly married couple, when they handle among themselves, I think the problem will be solved much easier. But when the parents of bride and bridegroom, when they enter and they try to put their thoughts into the children's mind, and they try to talk it out through them, so then the problem arises, and then the quarrel starts.
Okay.
I think there are many cases that come to my mind when you asked about this, because there are people who come before marriage.
Okay.
So they are engaged to each other. One of the spouses is dealing with some psychological issue. So they come to us before marriage because the other spouse is like, what is the guarantee that this is going to last? Or what is the guarantee this can be treated, this can be cured? They're very anxious about those questions. And also, what about the generational heritability ratio? Like, will it pass on to the kid? Will they get it? How much do we get into this marriage? So there are some ethical dilemma questions like, should I get into this marriage? So we are like, this is a very complicated situation where we are expected, they corner us and they ask us, you answer yes or no. So we can't give a yes or no. That is impossible. So that is one of the scenario. Then the other scenario that happens is this very sad, it's a sad, unfortunate situation that people lie to their spouse and get married. They've been having some psychiatric illness before the marriage and they don't want to reveal for obvious stigma reasons. And so then what happens is the after marriage, because of the stress factors like Dr. Pavan already mentioned, adjustment issues and involvement of the parents and everything, all these factors combined will cause the flare up or relapse, or they stop using medications also because they don't want to reveal that they are on medications. So they stop abruptly, there's sudden stoppage. All these factors combined together, there's again they're going to relapse. The symptoms start showing up. That's when the in-laws are like, oh, what is this? This is something we didn't know, something like this exists. So they feel very betrayed. They feel like they've been lied to. They feel like there's a violation of marriage itself because you're not supposed to hide such a big factor. But now that they come out, they try to get a like stamp on it. Is it really psychiatric illness? So they come to us. They want to make it, some of them are really want to make it legal. They want a divorce based on it. So they come to in that aspect. Or some of them come out of anxiousness. Like the wife is pregnant, she's acting like this. What are the chances that she's going to harm the kid? Or what are the chances she's not able to deal with the kid later on? So they are in that dilemma of whether should we leave the spouse or should we carry on. So they have a lot of questions, a lot of confusion, and at the same time the patient's family members are like, don't reveal. So that is the dilemma we go to, like ethical dilemma that we have.
Right?
Yes.
It is a very complicated subject.
Yes, it is. Definitely is.
We got some great insights about this disorder, psychiatric disorders. And we'll wind up this session. One last question we'll ask. It's about AI.
Okay.
We have artificial intelligence already rolling out in 2026, and it's going very fast. And in our medical field also, it's going very fast. That artificial intelligence are already, it's already like, it has removed so many people's jobs and
Replaced,
it has replaced so many people's jobs. So how about this AI replacing psychiatrists? Like how, can it replace psychiatrists from this field?
The only branch I think AI can't replace is psychiatrists.
Yeah, I know.
As long as they don't have a heartbeat and are not able to wipe a tear from the patient's eye, so we are safe.
Because maybe AI can't show you empathy, right? It will tell you in words, oh, so sorry, but it can't be so sorry, right?
Yeah, it can't be sorry.
Yeah, it can tell you sorry. It can't be sorry. So that can be, and human touch and human presence can never be replaced by AI. Yeah. You're talking to a computer. You're talking to a computer and telling all your problems. Obviously, it will not respond in the way how you are expecting it.
Yeah.
But when you're talking to any human, not be a psychiatrist, not be a health professional or mental health professional, so you talk to your friend or anyone, the human feel what you have can't be replaced by an AI or a device or a material.
Yes, true.
Yeah. That is the thing. What is unique to humans, right?
So there are some positive points though. Like AI is good for assist.
Okay.
Yeah.
They can be great at screening.
Mm-hmm.
So you put them the diagnostic manual on it. So you get screen like many people at the same time, which is not possible by a single human. So that is one thing that AI is good at, screening, diagnosing. But the thing is, psychiatry is not just what is said. That is not. We are all about what is not said, what is left unsaid, what could have been there. We're like dealing with the pauses, we are dealing with the body language. So we are all combining all these things and then we are asking them, is something there? So that is not possible with AI. AI can't deal with the pauses, at least not now, that is what I'm thinking. So at some point, I think even then, even if they are able to do what people want is not just what they're hearing. They want to be felt. They want to be understood. So that doesn't come from a robot or that doesn't come from artificial intelligence. That's just in humans. They want to be understood by another human. So if they're listened to, they're understood, they're happy. So even if you're not able to treat them, diagnose them, give them a label, they're fine. So that is more important.
So what are the advances in psychiatric department regarding AI, artificial intelligence? What are the artificial intelligence advances we have in AI in the psychiatric department?
So actually now there's AI where they are going to show they create that environment. Okay. Now if you have a phobia of like jumping, like heights are your phobia, so you don't want to jump from a height. You can't do that in real life stimulation. You can't give them that stimulation. But when you have an AI, you put on that avatar and you're able to stimulate that environment where that
By virtual reality, we can-
environment is created. Yeah.
Yes.
So virtual reality is created so that they're exposed. It looks almost the same. So they're feeling that fear. They're able to deal with that fear, and then chronically, when you're giving this exposure, slowly that fear is going away. So in such
Exposure
scenario,
response,
it deals better. I think when you can't do such a real thing. If the person is scared of snakes, you can't put him in a room of snakes. That is ethically not possible. So
virtually
yeah, so you create virtually. So this is, although it's costly, but still it's like a better way to deal with them. And also now patients who are dealing with hearing of voices, psychosis. So they are so confused that they don't know what to do with it. They're hearing this voice, they don't know what to deal, how to deal. So AI creates this virtual environment where they are told how to deal. They're normalizing it so they can deal with it better. So how to not follow the commands. Suppose the voice is telling you go kill somebody or go do something. So they don't know that the voice is not real. So they want to deal with that voice. So the environment is created with AI. So that is one of the advantages of AI.
Fine. Okay, my next question would be, మనకి ఇప్పుడు ఆల్రెడీ వీ హ్యావ్ ఆన్లైన్ అండ్ వీ హ్యావ్ ఆర్టిఫిషియల్ ఇంటెలిజెన్స్. సో యూ పీపుల్ ఆర్ డీలింగ్ విత్ ద పేషెంట్స్ ఆన్లైన్ అండ్ ఆఫ్లైన్. So what would be the difference between online and offline sessions, and how this helps people, and what are the drawbacks of online and what are the drawbacks of offline?
Okay. So one thing is offline, we are able to see everything. We are like, when the patient is not even talking, we are able to observe. They walk into the room, how they are interacting, their body language, their everything. Offline, again, it is either on call or on voice or on. They can be video also, but is again restricted. You can't see the whole body. It's only till the face. So that again restricts us. Suppose we see a patient at this swelling in the leg, so you know there is a problem there. So you want to ask about it. But when you're seeing online, that is restricting you. So that is one of the drawbacks. And also the warmth is not there. Like online feels like a disconnect. Again, almost like AI.
Device.
So
From device.
there is some, the connection is not there. When you're seeing offline, you're able to deal better with the emotions. They are able to open up better. So that is one of the disadvantages, I think. But advantage is that it's available. You can do anywhere, anytime. Convenient to you. You don't have to travel for it. There are patients who come so far away places, so they are spending so much time and effort, and then they're coming here, and then if you're not available, they're disappointed. So that takes like they feel disappointed. You don't want that from them. So you can tell such patients ki, okay, I am available whenever you want me in so and so duration of time. You can call me whenever. If you have a phone, just call me, so I can deal with it online. So this is for patients who are very far off or not able to come to you, or for other reasons they don't want to spend. It's like phone call is hardly any amount spent. So it's directly the transportation fees is cut off. So that's like an advantage for them. And some of them, like the family members are far away, they want to ask about something, some doubts. So just for a doubt to come to a clinic is like too much effort. So that is also an advantage.
Family therapies will be very easy for anyone, because you can't align all the family members to quit their jobs and come, and not quit the job, to take the holiday, especially for to meet a doctor. Like entire family can't be come. So but when it is online, I think it's better just a Zoom call. If you send the link, I think they will be open. They can open it from anywhere, and they can sit and discuss openly with a mental health professional who is available. And one more thing is, like as Dr. Nidhi has told, like offline is much better. Even I feel the same way. But the thing is, every time it's not possible. And many of the patients, because of their hard living life or because of their schedules, and most of the patients are hard working, and they have to do the work every day, or they have to go to job, and they have their own deadlines and everything. So once a patient is already come to an offline session, I think for him to follow I think the number of follow-ups will be maintained in offline, in online, better than offline, because it's easy for him, because he need not to leave the space. He can take the session wherever he is there. Even for suppose if you're in the office, you can just take a break for 15 to 20 minutes and you can take a consultation in between, and you can go back to your work, so that you need not to take an off for the entire day. It will be easy for the patient and even for the doctor. So the follow-up will be better. So he will see, once the thing is like when a patient has come with some problem, if he is completely cured, I think that is the more satisfaction the doctor gets than all the other things.
Emergency also you can't deal with it online.
Online we can't.
Yeah, we can't deal emergency.
Like if they are in a very serious situation, panic attack, online you can't console. It's difficult.
Online,
True, we can't console. Yeah, that is a good point. But what the thing is, you can't console. But if obviously psychiatric facility is not available, all the places in India, it's only in the 3-tier. It's in the 3-tier, 2-tier, and 1st-tier cities and metropolitan cities. And even when you go to districts, also you have the psychiatric facility only in the district hospitals, not in the PHCs, not in the CHCs. So if you have a mental health professional at your hand, you can ask anytime like how we can manage it right now. For suppose, as we were discussing about the panic attack, which is an acute thing, if you have a consultant within your hand, he might not give you a medicine from that, but he will be able to tell you and how to manage it non-pharmacological way. So there is always a hand for you to help, easy to access.
So as a doctor, I think I would prefer offline. But as a patient, I think online is without stigma. Nobody's seeing you going to the hospital, visiting a psychiatrist. All that is not there. So that online thing, stigma is little less. That's what I think. And from the patients who told me that they prefer online for such reasons.
Yeah. What I feel is, after you people discussing about it, what I feel is like, once it's mandated to come offline and, seek professional help. First visit. After that, you can, follow it up with online sessions. So that would be a great idea, to follow, right? Yeah.
According to that only, they have, they have put on a guidelines called Telemanas guidelines, which the website which we are working on it is Amodhealth. So they are following all the Telemanas guidelines. There are few schedules like which medications we have to prefer for which consultation. There are few guidelines which are given very detailedly. They have made it. So through that, they are like not only me, all the doctors who are available in the website which we are working. So they are following those guidelines and doing the treatment. I feel both offline and online both are required. But when there is access, you can go to online. When you don't have access, and when you need to take some day out of your time, some time out of your day, and go standing and waiting in the offline clinic. You can schedule a meeting at perfect time, and you can get it done as required.
Yeah, online is convenient.
Yeah, convenient.
Yeah, as a CEO of Amodhealth and the website which you are building, I wanted to know more about Amodhealth, because that would be the last topic we will be discussing,
which we have started since last 6 months. So my main idea is a digitalized platform which will have holistic approach of psychiatry.
Okay.
Or not only psychiatry, mental health.
Okay.
Like in that basis only, what we have did is we have psychiatrists, psychologists, psychosocial workers, speech therapists, we have art therapists, and we have graphotherapists, and even include even with that additionally, now we have started digital yoga, online yoga and meditation, and online Zumba, all the other sessions for a physical activity. Why we want to do this? And we have a sports psychologist on our board, which is very rare, very less. This sports psychology is very less. Very less people are aware out of it. And even my ideology is, if someone comes with a problem with a mental health to the website, I think I should be able to provide all different facilities or holistic approach. And all the facilities are there in single website, and this is unique, and this is the only website which is having all different verticals of mental health in single platform.
Very good to know. Very good to know. So we'll wind up the session.
Yeah.
So okay, thanks for watching us. And this is Dr.Mask, and I'm sitting and talking with Dr. Nidhi and Dr. Pavan Khande. Both of them are senior consultant psychiatrists in Amodhealth.